Look, we're going to turn our attention to things a little bit less jovial, a little bit of politics for you at 12 minutes past 6. The UK's biggest trade union has announced that thousands of ambulance workers and 999 call handlers now intend to strike in the run-up to Christmas.
The union said an exact strike date has not yet been set, but added that large numbers of its members had voted to take strike action over pay and staffing levels.
Well, this follows the news that health and defence officials are drawing up contingency plans to fill frontline roles in hospitals with military personnel.
And with us now is the women in think tanks, Phoebe Arslanagić, is that right?
Arslanagić-Wakefield.
Good morning. So let's start with that strike. 200,000 NHS strikers in total due to walk out, beg your pardon. How will this affect the public, and are the public behind it?
Well, I mean, it'll affect them a great deal. I mean, we've all been affected by industrial action in the past few weeks. You know, tricky to send a parcel because of Royal Mail strikes, tricky to get on a train because of RMT strikes or take the tube. But actually, of course, NHS strikes, I mean, a much, much more serious proposition. We already knew that the Royal College of Nurses planned to walk out up to 100,000 nurses. I think that's the biggest strike in their history. Ambulances, as you say, last night. I'm probably going to hear more about those. Perhaps those strikes are actually going to get larger in scale tomorrow. And you can imagine, you know, the concern, you know, our loved ones going to be able to get to hospital over Christmas? Is there going to be anyone there to treat them?
Yeah, so as you say, the combination of this new strike being announced and that nursing strike and the impacts on hospitals, we now know big famous ones like the Royal Marsden Centre for cancer treatment in the capital here, the Alder Hayes Children's Hospital, for example, all places where, you know, God's work takes place, if you like, important stuff done on a daily basis. This is confronting, I suppose, for the public, but the accusation from the unions is that the Health Secretary, that the government is not even sitting down to negotiate over pay. What are they asking for specifically? Because we know that the nurses have asked for RPI plus 5%, which comes in at a whopping 17%. A lot of people say they've just gone in too high on this.
Yes, but what the government's offered them just feels too low in the context of inflation. I mean, you're right that the government hasn't really sat down and had talks properly yet. There's been a lot of political chaos, which has potentially contributed to that. But these strikes have been signalled, I think, for some months. You know, it's been possible to see that they're coming down the track. Now the government is talking about contingency plans, bringing in the military. I mean, it'd be good to actually see some detail of those plans. These strikes aren't that far away. I mean, the nurses' strikes, 15th, 20th December, it's very soon. Yeah,
and it's worth pointing out that the ambulance drivers rejected a 4% pay rise, but the soldiers who will be replacing them took a 3.5% pay rise. So maybe the true heroes in this are the soldiers. I wonder, and we're talking later on about a new beast from the east coming in, and people are going to be hit by that. Worries about heating bills. I wonder if public support will be behind this if it gets really cold. They're already having to wait 1 hour for a cardiac arrest ambulance to show up.
I guess it's about who the public will blame. You know, if an ambulance doesn't show up, if the nurses are on strike, do they blame the nurses or do they blame the government? Actually, the public already isn't very impressed with how the government's been handling industrial action. Saw some polling that came out very, very recently from YouGov, which showed that when you ask the public which political parties do you trust more to handle industrial action, they said Labour, which is interesting considering party's history, the problems Keir Starmer's had this year in terms of getting his ministers not to go to the picket line. But Labour leads the Tories by 20 percentage points on that question.
And so Keir Starmer calling this nurses' strike a badge of shame for the government and saying that nurses have been driven to this by the Conservative 12 years of their authority. And he also points out that if they are too tired of governing, they should let Labour take over and sort this mess out. And as you say, it will be for the public to decide who's best to sort this out.
Yes, exactly. I mean, I think the public does empathise with nurses. You know, times are tough, cost of living crisis, inflation. People feel, you know, I think particularly actually in the context of the pandemic, you know, feel that the tremendous service has been done by NHS workers and people want to see them paid properly. And this is, as you say, a bit of a tired government that doesn't necessarily have a vision or a plan for sorting this quite difficult problem out.